calling all ladies and any husbands, boyfriends, anybody who realizes that their woman is feeling a little off during that particular time of the month, okay? Whether you're younger, like you early on, in the teenage years, or in your 20s, 30s, 40s, or you're about to go into menopause. When it comes to dysmenorrhea, we're talking about whenever there's any pain and discomfort associated whenever you have your menstrual cycle. That is always a sign that there is something going on. How many of you are like, wait, what are you talking about, Dr. Natalie? What do you mean that there's something going on? It's normal. Like, right, I just go to the cabinet and I just go pick up a Midol or Pamprin or whatever else it is, and then we just deal with it. Or, don't worry, I have it under control because I'm on birth control pills, so that way that helps me with my painful cramping, or so my painful cramping isn't so bad anymore. I'm here to tell you, it is never normal to be feeling pain and to be having cramping, and especially not with your menstrual cycle. Bloating, that's another conversation. Bloating is normal. That does happen. You have water retention, so you will feel bloating. Although there becomes a point where too much of it necessarily isn't normal. So talking about dysmenorrhea and discomfort and pain when it comes to the menstrual cycle is not, you do not need to deal with that. And I am an example of that. I was one at the age of 16. I was suggested to go on birth control pills because of my painful cramping and because I was an athlete. Why not control it, right? How many of you know people that are doing it for the same reasons, right? What you don't realize is that that pain is actually an indication that there is interference happening with the nerves communicating to your uterus and your ovaries. That pain coming from your uterus, having you billowing over, being so uncomfortable from that pain, is because the nerves are being dysregulated. I can't tell you how many women are having pinching off and inflammation happening within their pelvic region, with their pelvis, or in their low back, which is contributing to the pain that they're having within their uterus and their reproductive organs there. What does that mean? That means that we need to work on what the cause of the problem is. Why is it those nerves are being pinched off, inflamed, or irritated? Oftentimes it comes from the low back, literally, like whether it's from prior injuries, and it doesn't even necessarily have to be from prior injuries. It's just over time the body starts to pick up these types of stressors and it just starts to inflame the nerves. What I often see is when I'm taking a look at x-rays is I see a pelvis that is completely out of alignment. A pelvis should be even across the top if I were to draw a line, and I'll find that one side is lower than the other. And oftentimes those are the same people when it's a dramatic decrease or a dramatic lowering on one side or higher on the other side. That's whenever I'm seeing this dysregulation happening within the reproductive organs, and where I'm seeing that pain and that discomfort, or women told that they can't conceive a child because they have PCOS or endometriosis, and this has just become a normal way of life because, well, my mom had it, my grandma had it, like everyone around me has this pain, so it's normal. It's not normal. It's not. You can live a life having normal menstrual cycles, having regular rhythms without having the pain and discomfort associated. So to finish my story and my personal testimony, so the age of 16, I was on birth control pills until the age of 16, until the age of 22. And why did I stop? Because, well, one, I was still having discomfort, but 22, I realized and I attained the knowledge that, yeah, I probably don't want to be on that anymore because that's actually causing further damage where my body doesn't know how to produce its own hormones anymore. And that is how this cascade effect picks up. Your body knows what to do. It knows what and how much hormones need to be produced, so that way you don't have this dysmenorrhea or early onset menopause or anything of those sorts. So at the age of 22, I realized that's when I was going through chiropractic college, and I realized this needs to stop, and as soon as possible, because I need my body to be able to figure out how to take care of itself on its own. And I can tell you to this day, about to be 31 years old, ever since I started getting regular chiropractic care, I know when my cycles are coming, because I mean mood still can fluctuate. Sorry guys, it doesn't always totally change up. It definitely makes you not as crampy, or as cranky, I should say. But as far as crampy and stuff, I have so many people, myself included, where I forget whenever that time is about to come because I don't have that pain associated with it. Usually it's more sensitivity, as far as like quicker to fire, as far as stress, or why you're a little bit more antsy or something like that. So that, hormones do change, and they're supposed to change during that time of the month. But it shouldn't be as drastic, and you definitely should not be dealing with pain. which just so happens that is also linked up with the bladder, because the same nerves in the area that go to the reproductive organs also go to the bladder as well. So oftentimes it's not the nerves going to that area don't just mess with the reproductive organs, they're also messing with the bladders. And then there's people that get bladder pain, or how many people do you know that have recurrent UTIs, urinary tract infections? And then you're like told you need to drink juice, and that's a whole nother conversation, because when you're drinking that cranberry juice, it's chocked full of sugar, which just feeds the bacteria and makes your body have that infection, and like feed that bacteria that's causing the infection and the burning and all the discomfort. It just fuels it. It literally just fuels it to make it worse for a longer period of time. And if it is never addressed because of those nerves that are being inflamed, coming from the spine, coming from the spinal cord, through the spinal bones that go to the organs, go to your bladder, goes to your uterus, right? If they're not able to communicate, to tell it what to do, how to function, how many cells need to be reproduced, or how many cells need to be sloughed off, you're not giving yourself the best opportunity to be able to heal and function the way you were designed. So who, raise your hand. I mean, I wish I could see you on the other side. I'm sure you would all be raising your hands on saying it would be really awesome if I didn't have to deal with pain during my menstrual cycles. And it would be really awesome if it would become regular. That's another thing. Regular menstrual cycles, being able to predict them. They should be predictable, and they should be predictable as far as how all the details as far as the flow and everything else goes. So neurologically based chiropractic care could be that answer for you. It's been an answer for tons of women that have come through my office here. It's been an answer for me. And why would you waste any time any further starting to worry about some type of surgery or some type of procedure you have to get done whenever you can deal with it naturally, allowing your brain and your body to communicate through the nervous system by getting neurologically based chiropractic care, removing that interference that's not allowing your nerves to communicate to the rest of the body the way it was intended. I'd love for you guys to come into the office if you live here in Northwest Arkansas, so you can come in, and if not for anything else, just get some information to see where the interference is happening in your body, so that way then you can open up your eyes to the opportunity of all the other things and how everything else is connected, so that way we can get you feeling and functioning so much better. Feel free to ask any questions below this video, because I would love to give you more information if you want to know more. Otherwise, come into the office, take a tour, come in and get a complimentary consultation. And if you want to go know a little bit further, we will walk you through the steps to do that. So I'm Dr. Natalie Horine with Ignite Chiropractic, looking forward to serving you and your family one day. Bye now.